Hi, I'm Dr. King Rollins, chiropractor. I'm here today to discuss the cause of most people's spinal pains. Okay, so what I have here is a model of a section of the spinal column. Notice that in this section we've got two spinal bones called vertebra, and between them we've got a intervertebral disc, and we've also got a motor unit called where we've got facet joints. Okay, so in a normal healthy spine we have 24 of these movable segments, 23 discs, 50 of these facet joints, all of which need to move properly in order for the discs to get oxygen, moisture, nutrition. No movement, none of those things. The result is it can't repair itself from your normal activities. In time, because of that lack of movement, that lack of nutrients to heal, the inner fibers begin to weaken, and from the inside out, it starts to break. The inner fibers that hold the disc together break. The pulpy middle starts to push out, and eventually you have a disc bulge. As it progresses, you get closer to the outside layers, it becomes a herniation. This would be a model or a representative of a herniation. I want you to notice that there is pressure on the spinal nerve. When that spinal nerve goes down into your leg, you get sciatica. When it goes into your arm from your neck area, then it causes carpal tunnel-like symptoms where you start to get tingling, numbness into your hands. The point is that this is a case of spinal decay that led to first bulge, then herniation, then prolapse, whether that's neck or low back, same result, which is pressure on the nerve. By the age of 35, the average American has 4 of these. I also want you to notice the disc is somewhat thinner now, and because it's somewhat thinner, these joints back here are not really lining up correctly. It's sunken down and the facet joints are out of proper position. Again, age 35, 4 of these, no pain, because it doesn't hurt. Most people don't do anything about it. So 10 years later, those 4 that were decayed like this at age 35 move on, and we lose even more disc material. The bones begin to change shape. The facets become even more, the term we use is imbricated, where they're sinking down further, and then the nerves are even more irritated, typically both nerves by age 45. But even this doesn't necessarily hurt, okay? By the age of 60, those 4 have become permanently damaged, impossible to undo. If we take x-rays on the average 60-year-old American, they're going to have like 6 or 8 of these levels out of the 23 movable segments. So that's where the problem comes. The problem is this gradual decay process that is not necessarily painful. Most people will have the occasional episode of soreness or pain, but because they've got other relatively healthier levels of the spine that are compensating for the lack of motion in the damaged areas, the result is that their body just gets around it, and the stiffness comes on so gradually and so slowly that they don't even realize that they have a very unhealthy spine. The only answer for this is essentially the same as a dentist would tell you about tooth decay. Prevention is the key. We've got to prevent the spinal decay rather than treating it once it's there. The way you prevent it is with moderate levels of activity throughout your life and weekly adjustments. Weekly adjustments are necessary to keep those joints moving. They get locked up without you even being aware of it. And when they're locked up, that leads to this type of decay. And virtually every human being who's lived long enough is going to have at least some of this. Like I said, by the age of 35, 4 already involved. An additional 4 in 4 years after, 10 years after that, 10 years after that, an additional 4. I've met many people through the years that I've taken x-rays on at age 60 who don't have a single healthy level left in their spine, and yet in their mind, this was their first episode of spinal pain. Okay? Prevention is the key. Start at a young age.